Sexually transmitted infections are on the rise, according to the Centers for Disease Control and Prevention. The agency reports that cases decreased during the early months of the pandemic, but most were back on the rise by the end of that year.
Patients were not going for their regular checkups. Patients, even when they thought they were exposed, did not go for treatment. And many patients actually had what we call like a community barrier, in the sense that they stayed in the same place. And imagine a person who is infected, who is not going out, not traveling. There's a tendency to reinfect each other, especially in a small community.
Dr. Tosin Goji is an obstetrician and gynecologist. She says there are many ways to help prevent sexually transmitted infections. The first step is education. The public needs to understand what they are and the signs and symptoms. Those can include unusual discharge, itchy genitals, bumps, sores, warts, painful urination, and vaginal bleeding that's not a woman's menstrual cycle. However, symptoms aren't always present, which is why regular checkups are so important. Dr. Goji says if an individual suspects they have a sexually transmitted infection, they really should see their physician. They can treat the issue and prevent any further spread.
If you think you got exposed to sexually transmitted infections, or you have high-risk behavior, or you can't remember what you did in a recent party, or you had a condom failure, or you just feel like you've been exposed, then you should request to be tested.
Doctors say the most common sexually transmitted infections they treat are gonorrhea, chlamydia, syphilis, and herpes.